This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank. Katie Huckle is my co-host. And once every about 3 months, we love to have an update on what's going on with our local healthcare system.
We do.
And we have our community president for Munson Healthcare Cadillac Hospital, Peter Marinoff, with us once again this morning. Peter, how are you?
I'm doing well. How are you guys doing?
Good. Welcome, welcome. Peter, I wanted to tell you I'm loving the billboards that talk about how well the hospital is doing and what patients say about the hospital. It's just uplifting to be driving down the road and look up and say, lucky us, this is one of our community anchors. And so congratulations on that.
Thank you. And you know, it's great to have it out there to just brag a little bit about that we have at the hospital and just the healthcare we're providing in the area. We're really proud of it.
Awesome.
So some things have been, some reorganization. I know that you don't reorganize without doing an incredible amount of study and assessment and things like that. So there have been some things that are changing a little bit within the Munson healthcare system. Can you explain that for us?
Sure. And probably what you've heard about is rural care transformation. And you know, I think the easiest way to go about this is really to talk about the changes that are going on in the healthcare industry overall and just some of the challenges we faced. And, you know, it's staffing challenges, the economy driving up costs, just reimbursements not keeping up, you know, and I think patients are not only asking for more services, but they're asking for more convenient access points. So really what we're really trying to do is understand how we can better meet the needs of our communities and reshape that and meet them where they're at, while simultaneously, you know, understanding what our environment is doing kind of reimbursement-wise across not just the country, but also across our region. So it's really kind of setting ourselves up for the future to successfully deliver care in all of our communities and just create better access.
Can you talk a little bit in specifics about some of the changes that have been made?
Well, you know, so we haven't made any changes yet, but
the changes that are coming.
Yes.
Yeah. And so, you know, I think the first thing I'll talk about a little bit is I want to dispel one rumor that was out there, and that was that we were not going to do elective surgeries in Cadillac. That is actually not the case. We're actually looking to not only grow our surgical types of surgeries we do over time, but also to really increase our bandwidth and be able to do more surgeries in Cadillac. So elective surgeries are not going away. They will be in the community, and as always, you know, we're excited to serve the community. But, you know, I think the best way to really talk about, you know, the changes that we're doing, I'll kind of go more broad and talk about the purpose that we have. And that is to really, you know, we want to adopt a more patient-centric model. So, you know, we're really going to have to do some back-end investment in the patient experience and make it more seamless for our patients. So, you know, the easiest way I can describe that is what we would call one patient record. And so that's like our electronic medical record system. So as you go through the system and navigate Munson Healthcare, it would all be on one platform. Currently, we have 3 different electronic medical record systems, and it just can create some clunkiness. So that's something we really want to do. The second one is expanding our outpatient footprint. And really what that relates to is if you think about certain services that you might get, so if you're talking about access to primary care or access to lab services or rehab services like PT, how can we get those in convenient locations that patients will not have to drive long distances for? And there's enough what we would call volume in the immediate area to best serve that area. So we're really talking about expanding that outpatient footprint. And I think the start is really with primary care and just recruiting it. Enhancing our virtual care platform. And so, you know, this comes in a lot of different avenues, but the one I'll talk about a little bit for an example here is currently in our emergency department, we're actually looking to do what we would call virtual triage. So we can increase the speed with which patients can go through the ERs, not just in Cadillac, but across the system. So this is something we're actually bringing online, and we'll have probably up in the next month or two. But really the idea is that sometimes when you have a lot of people coming into your emergency room, they might, they all come at the same time. Some people might be able to be seen and helped faster than others. And so we can utilize what we would call teleservice, well, not a tele, but a virtual service, to help work those people through and get them the help they need, and have it be a faster emergency department visit for them.
This is fascinating. So you're talking about having people come in to the ER, but consult with someone via a screen, and then prioritizing. Is that what you're thinking about?
Yes, that would be the aspect. And
okay.
It's not that's not the only way you would visit. I mean, we still have our whole team there,
Sure.
But really it's that triage would help us in the process and helping people work through the ERs. So that's something we're working, with our emergency medicine providers on getting in place.
And that's interesting because, not all emergency visits are created equal.
Right.
Some people are needing to be seen more urgently than others.
Right.
So that sounds like an interesting concept. Did you consult with like other rural health systems who were doing this and putting this into place, or is this something that's entirely new?
I think this is kind of, I'm not an expert on virtual medicine, but, I would say that this is something that it's becoming more common now. And so in working with our emergency medicine provider, this is an opportunity they saw to help improve what we would call throughput in our emergency departments.
Okay. All right.
Well, I was going to say, there's two other really quick things.
Yeah.
I'll hit them here, but we really want to get to what we would call regionalizing our inpatient services. And what that's about is, if you think about it, we're somewhat limited in some of the specialists that we have in and around our hospitals. So what we're kind of looking to do is adopt what a lot of health systems across the country are doing, and that is kind of have a regional model. So Cadillac would be what's considered a regional hospital, and so we would have what we would call a higher inpatient service in our hospital than maybe a community hospital, and a community hospital might be like in Manistee or Paul Oliver. So really it's to try to really define, here's how we're going to support the needs of patients in various communities and what makes the most sense. So that is something we're working on. And then last but not least, elevate Munson Medical Center into what we would call a more high-level specialty care center. That is something that we're working on collectively through the system, and really get, try to create an easier transfer process around the system. So over the last year, we've started up a transfer center in the system, and it's actually been pretty amazing in that we've been able to, I think, move patients around the system better. So maybe they don't need care at the medical center. Maybe it's they come to Cadillac. So we're shifting that way, but we're not having to send as many people outside of the system. And what we've heard from our communities is that they want to stay local, and they want to stay in northern Michigan. And so this part of the plan is to really help us become better at that and reduce those transfers out of northern Michigan.
And it makes sense because people have a level of trust with their own doctors.
Absolutely.
Totally.
Mm-hmm.
Yeah.
Mm-hmm.
So those are the overarching things, and I think maybe your main question. And I've spent a long time on this, and I apologize, but I think the big thing would be, well, what really is changing for Cadillac, and my answer would be is that we'll continue to shift to be more of a regional hospital. So there's probably not a whole lot of change for Cadillac, other than we will continue to evaluate and grow services here and look to offer more, and really kind of become more of a hub, if you will, for our surrounding areas.
Peter, does that mean that we'll be recruiting more doctors to Cadillac?
We're always recruiting,
Okay.
so if there's any doctors listening,
Right.
so yeah, we will continue to recruit more to the community, and with that, it's working with our specialists. So we really have a pretty solid team of OBGYNs. So Dr. Curran, Dr. Tremp, and Dr. Frankowiak. But we'll always kind of look to see, could we add another OBGYN, because there is a huge need for women's services in our community. So we'll always keep those doors open. Orthopedics, very similar. We have a great orthopedics office. Love what Biz is doing, and Fred, and we'll always look to see if we can add to his office and bring in more physicians to our community, because the need is definitely there.
Okay. Good to know. So does it mean also, I'm just trying to wrap my brain around the change, that possibly more specialties will be offered at Munson and Traverse City? I mean, is that a possibility with the shift of putting these patients here and these patients there, and not having packed ERs all the time with people waiting? And I mean, does that mean that we'll be able to offer more in Northern Michigan?
It does. I would say that probably the offerings, we have a pretty good selection of offerings and specialty services for the communities of Northern Michigan. What we really actually are trying to focus on with the medical center is to get more providers in there to build on that. So neurology is a huge need in and around Northern Michigan. Rheumatology is a huge need. So how can we kind of work to bring in some of those specialists and better support those services, not just in Traverse City, but maybe in outreach? Mm-hmm. I don't know if that helps to answer that question, but I would say it's more building up some depth in those areas to reduce those wait times.
Okay.
When you speak of depth, and I work in the career and technical education aspect of the world, and we're providing, as career and technical education as a whole, are providing a lot of career tracks where people are retiring faster than we can put people into those jobs. Do you find that to be the case in healthcare at large, whether it's nursing or whether it's primary care or specialty doctors? Are there enough people going into that at the college level to fill the retirements that are coming up in the next 5, 10, 15 years?
That's a really great question. and as you could hear me pausing, I'll hedge a little bit and say kinda.
Okay.
And so, which isn't a great answer, but I think if you're looking at there is a what I would call shortage that we can see coming, and so there's not as many people going into certain fields, and that's why it's just very important for us to work through this care transformation plan, because we can see the environment changing around us, and we can see what the future holds. And so if we can become more efficient in how we're providing care in the region, we can decrease wait times, we can increase access to care. But what we have to do is just better position ourselves in and around the communities and be able to kind of work better through the lines. So I know electronic medical records doesn't sound very exciting, but I mean, truly, having one system will make all the difference in the world. Mm-hmm. Having, we have a new CT scanner. It was just delivered last week, and it will be up to full operation. I think by the end of January or early February, and it has more offerings. And so by being able to do more testing local here, we can relieve the stress on the one in Traverse City, and then, physicians can read everything virtually and have communications, and we can route emergent patients faster, if they're having strokes. So there's so many different things we can do, but we just have to, I think, get some of these things set up, and that's really our focus work over the next, I would say, about 2 years, is to better position ourselves for these upcoming challenges we can see.
I feel a sense of relief knowing that we're getting better. We're getting more efficient. I mean, what's more critical than healthcare? And we know what we've been through and how taxed the hospital team was and the entire organization was during the pandemic. And so if we're this efficient and, up to snuff, if you will, because you use the word clunky, I think that's such a good word. And why does this need to change? Because it's clunky, then we're positioned to work well, but for what could come in the future, because we've seen that, so it's reassuring knowing that you're on it, Peter.
I wouldn't say we're completely on it, but we are trying. And
yes,
I think you have to in all industries you have to continue to evolve and change, and that's really what this is.
I'm smiling because, as Rich talks about, are there enough people? And you're saying we're always recruiting. We're at a season when there's a new generation coming up, and work-life balance is more critical than I think what we've ever seen. And you get doctors out there like Bizzigatti who puts in an incredible amount of hours. I mean, the list goes on of doctors that work, 60, 70 hours a week. The up-and-comers, they don't want to work those many hours. And there's nothing wrong with that, but then it's going to take more doctors. So I think as community ambassadors, we need to be pumping up Cadillac in northern Michigan and talking about what a beautiful place it is to live and to raise a family, so that we can just have a positive vibe out there, so that when you're recruiting, the message is out. You want to live, raise your family, and play in northern Michigan. And so come and work here too.
Yeah, to build off that, Katie, I won't reveal the name, but we just had a recruit for a specialist coming to town, and we toured him through. We talked about all that you could find in Cadillac, showed the hospital, and he was really impressed, not just with our teams, not just the awards, but also with the community as a whole, and learning about the community. And a big driver for him was he could feel the sense of community, but also it felt big enough to him that they could really have a lot of different things to do around here. So it's a great spot.
Wonderful to hear. I smile about just your entire team at the hospital. A very close friend that passed that didn't think he wanted, a church funeral. And the chaplain came in. And by the time that chaplain left, he wanted a funeral in a church, and he was feeling much better about the situation. So it goes across the board, with everyone there. It's all hands on deck. We're here to serve at every level. And the community is 100% behind you guys.
So, Katie, Peter brought up the pandemic, and most of us would like to forget that period of time.
It's true.
But you have to have a sense of what it was to know what it will be.
Right.
And I would like to ask the question of you: what changed during the pandemic that stuck? Is there anything that you looked at pre-pandemic and the pandemic occurred, and then you thought, well, maybe this makes more sense to just do it this way? Were there any changes in healthcare post-pandemic?
Wow, man. Boy, that's another really good question. I think probably the easiest one that comes to mind was the realization that we could do more care virtually, and we could offer more, but there still is a need for that in-person touch also.
Yes.
And so it's a blend. And so, I think it's virtual, whereas before it felt like it was this anomaly, space age thing, and it never felt like it was a real tool in our toolbox. I think what I see now is that is more of a tool in the toolbox for healthcare, and it's a practical way for, I think, a lot of people to handle care. So, an example I'll give is something we really got going during the pandemic was our nurse call hotline. So if you think about it, you could call in, and it's an Ask a Nurse line, and have a connection with the nurse and do follow-up that way for, I was just in the ER, I have this concern, and talk to them. And so that was a very what I would call convenient and valuable service for a lot of people in the community. That actually went from being what felt like a partial thing to now it's actually full time and a big thing. So I think it's those kinds of connections, but not just the Ask a Nurse hotline, but also virtual. That's become more ingrained.
Mm-hmm. It's more accepted too. We all know we've got family members that are older that are like, I don't really like computers or technology. It became more acceptable to do things virtually, and I think we all had to up our game in terms of accepting that. And okay, this is the new way. We're going to have to learn the new way.
It's interesting though. My mother is 81 and she has no interest in learning the new way. She's like, I want to see someone. I do not want my healthcare coming over my computer screen. That's an 81-year-old's perspective, but that's something, Peter, you have to consider too. And
I'm laughing because I have met your mother and she calls you Richard, and I love it. Okay, but yes, back to what Rich is talking about. How do you address that with elderly folks, Peter?
Well, and then but that's kind of some of the conversation is you have to meet people where they're at, and so in this case we're going to have patients that they want all those visits in person and they want to do that. So how can we best meet those needs? And then we're going to have people that want to have the virtual option. So I'll be honest. My sinuses love to get an infection twice a year. So that's a really great one where I can just set up a virtual appointment, visit with the provider from the convenience of my office. It's 5 minutes. They kind of assess, this is what's going on. They send in the script, and I can pick it up, and nothing was disturbed.
That's such a great example, Peter. I think that's what people need to hear is, okay, what specifically, and you said something else that really, I think you said overlapping. When someone's shipped out of town, let's say Detroit, Ann Arbor, whatever, that's hard on the family unit or the support system, financially and emotionally, because they want to visit and they want to be part of the process, and they're already really worried. So it's so much better to have the person, still in northern Michigan for them and the family support that they need.
definitely.
Okay.
Has there been a reorganization of online resources too? I think I read an email not so long ago that there's been a consolidation of websites, things like that, so that there aren't so many folks operating and spinning in their own universe. Did I read about that?
So specifically with Munson?
Yes.
Yeah. So we did have a lot of websites. So we were trying to really pare that down a little bit, because you could actually find that maybe something wasn't maintained to a current standard, or it could lead you to a dead end, or maybe even it wasn't, in not maintaining, the information wasn't current. So we did pare down some of those websites to better connect them.
And you have to do that, and that seems to be a Herculean task with so many facilities in the system, right?
It is, well, and so 7 hospitals, and then you have lots of clinics, and I think if I think about to the west of here, there's 2 different fitness centers that are part of the system, and they were having websites. So there's a lot of nuances to it. So yes, it was a task.
Well, and we're so grateful for the websites, because in a world where information is just nuts, I think these websites became critical to people as they look for hard data and what to do. Dr. Whalen was explaining, how to build resilience one time, and I went to the website and printed it and taped it to my computer screen at my office. I mean, facts are friendly. Let's go get the facts from the experts. So I think we need to thank you for making those websites accessible to us, and it's how we're going to stay healthy in many cases.
I will give all the credit to corporate communications and IT. I cannot take any credit on that one.
Okay. Yeah, well, you oversee everything, Peter, so there you go. Well, we wish you so much luck with these changes, and as community members, I think it's important for us to support the hospital and, again, promote the community as you continue to recruit, grow, and build and get better. And we just want the billboards to keep coming to remind us how good you guys are.
Well, again, I appreciate it. No one was more happy than me getting the billboard up. So,
That's right.
Yeah.
You get to tell the story of your team and your hard work.
It really, I can't tell you how proud I am of the care that's provided day in and day out, and just the dedication of the team. So to be recognized for it is great, but then to be able to kind of promote it out there and share with our community on a bigger scale, it means a lot.
Mm-hmm. And I think it engenders trust in the healthcare system, because it is very, very important as a local resident to be able to know that you're going to have the best care when it's needed.
That's right.
Yeah.
Mm-hmm. People we're so mobile these days. They can retire anywhere.
Mm-hmm.
And talented doctors can work anywhere,
right.
So why here? And that tells the story. We're the spot. Come and see us.
It absolutely is. Peter, we appreciate your time again, and we'll look forward to visiting with you again in early 2024 for some more updates.
Definitely. Thank you all so much.
Peter Marinoff is the community president of Munson Healthcare Cadillac Hospital. And Katie, will do this again next week, same time, same station, on Cadillac Unscripted, sponsored by Independent Bank on 107.9 CDY.